don't know that ChatGPT or Claude can take the place of that. Maybe it can, maybe it will. I don't know that it can today, but even experts who use these tools today find there's flaws in there, and they're so convincing that they're correct. A friend of mine recently was diagnosed with a rare disease, and he had some lab work done, and he called me on the phone and said, "Hey, I know what I have. I have celiac disease." I said, "What do you mean?" "Well, here's the blood work." And I'm like, oh, when I looked at the blood work with him, and I'm a physician, right? I've been trained. I've seen patients for 10 years. I looked at it and I said, "What makes you think this is showing that you have celiac disease?" Because all the labs were negative. He said, "Oh, no, 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 look here." I'm like, "No, no, no, you're misreading it. It doesn't say what you think it says." And
Right.
it actually, it did support something that they had, something else that they had, but all that was confirmatory that they had the other problem. So my point here is that if they look at data without that critical context, whether it's data that they get from Labcorp when they get there, or they look at their medical records, if they don't have this clinical context, they have the risk of making really, really bad life decisions. And I realize it sounds a little snobby for me as an expert to say you need the experts, but honest to God, I really do think you need the experts. And I don't think that the general lay public has the training or understanding. And I don't know that ChatGPT or Claude can take the place of that. Maybe it can, maybe it will. I don't know that it can today, but even experts who use these tools today find there's flaws in there, and they're so convincing that they're correct. These tools come at you and they stroke your ego. They tell you, "Oh, that's a great idea. Oh, you're thinking about this in exactly the right way." And unless you think about it and use these tools with a very critical eye, you can be led down a garden path and land yourself in a world of hurt. And that's one of my biggest concerns here.
I can tell you from my own experiences that it's been very, very difficult to push back on the whole concept of democratizing the data, particularly when I was working in some health systems, because people had this great technology. They could move data quickly, they could do classification and all this other stuff, and they just wanted to move at Mach 10. I'm like, guys, we don't even let our own people in my data team produce something that doesn't get passed by somebody with a clinical eye. If it's
Yep.
clinical data, it requires some expertise that's beyond just being a technician who happens to be able to read. I'm not going to be the guy to step in and to answer clinical questions. Now, I've been in healthcare 30 years, but there's no honorary MD. There's no such thing
Exactly.
that has any meaning whatsoever. You can't have the context, and I think this is where it bugs me with to what you were saying about how people are using the Claude or whatever, ChatGPT, is they won't even know what's relevant in terms of context. I mean,
Exactly.
things that you would know. I mean, just being able to look at a patient that's sitting in front of you that has some body language it's telling you something that they're not saying.
That's exactly right. And if you, and this is another thing, when I started my role at BMS, I asked my team, I had 50 people on my team. I asked them, how many of you have actually set foot in a clinical trial? Have you ever been in and watched or participated in a clinical trial? Because this group's job was to interpret data from clinical trials. Now, I have come, my informatics training is stemmed from having 10 years of clinical experience on top of, the next 30 plus years in informatics. So I can look at things with a lens that sees both sides of that coin. And if you don't have that lens and you just look at the data without a clinical perspective, you're going to miss stuff. And this is the democratization problem that I see, that if you don't have, and like when I found out that only 3 people out of 50 actually had ever been involved with a clinical trial, or been watched like blood drawn for a clinical trial, or been in a place where the patients were being interviewed by a trial manager, like no one had. I don't know how you do a job like be a data analyst without that kind of context. I have no idea. I set up a program where I sent those folks out to go get that context. I felt it was that important. And I think that other organizations should think about that as well, that clinical content. So Beth Israel runs a program for at the Division of Clinical Informatics, a fellowship for